Hello, this is Stella Rockwood, and I am going to be doing my newborn assessment. I'm going to go ahead and put the camera down. That way you can see the baby. All right. So I would knock on the door. I would perform WEPA. I'd wash my hands, introduce myself. I would identify my mom and baby. I would compare their wristbands. I would pull the curtain for privacy. I would let mom know that I am here to do a newborn assessment. And then I would just ask if she's got any allergies. She doesn't. So since my baby is sitting here all quiet, I am gonna go ahead and take the temperature in the underarm. Temperature is 97.7. That is normal. And while the baby is still quiet, I'm going to listen to the baby's lungs, heart, and bowel sounds. That way I can listen better. I will start with the lungs. Okay, and then I'll go to the heart. And finish with the bowels. All right, everything sounds great. The bowel sounds were active in all 4 quadrants. And the lungs were clear, they were even, the heart had no murmurs. As for respiratory, a regular rate is 30 to 60 breaths per minute, and a regular heart rate is 110 to 170 beats per minute. And for both of those, you really want to listen for 1 full minute, as babies can have periods of apnea that can last about 20 seconds. So you want to make sure that you listen all throughout that. That way you don't get a period of apnea and have a false count. And then you also want to make sure you do the breath sounds on the back too. So once I flip the baby over, I would do the breath sounds as well. You also want to be looking out for respiratory distress. Some signs of those are nasal flaring and grunting. That is definitely something that you want to be notifying us about if that is something that you notice. Then after I've done my listening, I'm just going to look at the abdomen and chest, make sure the baby is breathing evenly, the belly is rounded, everything looks even and symmetrical. Then I'm going to move up to the head and just work my way down. I'm going to first palpate the sutures, making sure none of them are overriding on each other. I would then check the anterior and posterior fontanelles, and they would be soft and flat. Then I'm just going to look at the face, make sure the face itself and all of the baby's features are symmetrical and even. I want to make sure that the pinna is in line with the outer canthus, and I'm gonna just go ahead and pull the ear back, and I could use a pen light and just look in the ear, make sure there's not any secretions. I could then go into the nose and just make sure there's no secretions that are abnormal, and also make sure the airway is patent. And then I'm gonna look at the eyes. I'm going to make sure that the sclera is white and the conjunctiva is pink, and then I can move on to a couple of reflexes. I would do the stroke reflex, which I would stroke the baby down the cheek, and I would want the baby to turn its head towards me as if it was going to feed. And then I would also do the sucking reflex. I'd put on a pair of clean gloves, stick my finger in the baby's mouth, and make sure that the baby sucks. Then I would just look at the skin overall, make sure that it's even, it is warm and dry throughout. I could check the skin turgor by pinching and make sure that it goes back to normal. And then I'm also gonna go ahead and look at the pulses. I would do the brachial pulses both at same time on each side to compare. And then I also want to do the pedal pulses, same thing, same time, and they are strong, which is great. Then I want to look at the capillary refill on all 10 fingers and all 10 toes. So I want it all to be brisk. All right, looks good. Then I'm just gonna ask mom a couple of questions. I would ask her about her baby's first meconium stool to make sure that that has happened within the first 24 hours. I would also educate her about the umbilical stump. It will stay on for about a week. We want to make sure that we're not submerging it in any water or anything, and monitor for any redness, swelling, drainage, or irritation. And at this time, we've woken the baby up, so she's moving around. All of her extremities, she's got good range of motion, good muscle tone, definitely active and strong. And then I'm gonna flip the baby onto her back. I could go ahead and listen to her breath sounds on her back. Sounds good and clear. I would also check for any abnormalities. I want to make sure the spine is straight. Everything looks good. And then once the baby's flipped back over, we can go ahead and go into the diaper area. I would unlatch the diaper. I would be inspecting for any sort of rash. I would also be asking the mom how many wet diapers per day her baby is having. We want to let her know that her baby should be having 1 wet diaper per day, 1 more per day until day 5. We want to have 6 to 8 wet diapers. And then I would also ask her about breastfeeding at this time, making sure that she's breastfeeding every 2 to 3 hours. And then I would look at the genitalia, making sure there's no rash or irritation, and we could put the diaper back on. Then I would go back to some other pulses. I would check her femoral pulse, both at the same time. And that would be while her diaper is off also. You can get a better feel for it then. Then I could go on to some reflexes. I would do the palmar reflex. I want to put my finger in her palm and I want her to grasp my palm. And then I would also do the Babinski, and that's when I take the bottom of the foot and move across, and I want her to flare out. And then I also want to do the Mara reflex, where we startle her. I grab her arms and just let go really quick, and she gets startled, and there she goes, she's crying. She's got a nice lusty and strong cry, which is good. And then after that, I would just move on to teaching my mom. I want to do the bulb syringe, instruct her to squeeze to get all the air out, and we can put the bulb syringe in the back pockets of the mouth and in the nose to suck out any secretions we need to, and we could pat it down on a napkin. We could also educate her to notify us for herself and the baby if either one of them get a temperature reading above 100.4, they need to notify us. And also if the baby has 2 or more green or watery stools, to also notify us. And then at this time, I would put the baby back in her crib, make sure she's comfortable and covered up and warm, and let the mother know that I would be back to check on them and to let me know if there's anything else that I can do for them. So thank you so much.